disclaimer that I don't have to do what I feel the need to do. We choose to share our family publicly because we enjoy it, it helps to advocate for adoption from foster care, and it also helps to give people hope. We do not and have not made any money off of any of our news appearances, articles, or podcasts. Not even the People magazine article. We do not ask for money, ever. Our Venmo and PayPal are linked in our Linktree because people wanted to donate to our foster care toy drive and our foster care closet, which we do solely on volunteer hours. Yes, we have a merch shirt. The profits go directly through Pledge Link to a foster adoption agency. So it's impossible to say we're exploiting our children for money when we have no money. So stop trying to tear us down. We're the Doherty dozen. We don't quit. Live earlier, I just wanted to follow up with you because I know I got off really quick and almost in tears. The twins' biological dad did call, and it just wasn't very good news. That story is not mine to share, but what I do want to share with you is that when you decide to do foster care, you're not just taking in a child, you're taking in their whole family. For so many of these families, this will be the first time in their entire life that they have somebody believing in them and supporting them and answering their phone calls. The twins' dad bounced around through foster care almost his entire life. When we adopted the twins, their dad became our bonus son. We're his first call when things go wrong, and we're also his first call when things go right, and he wants to celebrate. So new foster families, prepare your heart to take in the whole family. I need like an hour to list them all, but here are the top of the list. Fetal alcohol syndrome, fetal alcohol spectrum disorder, reactive attachment disorder, OCD, ODD, anxiety, autism spectrum disorder, ADHD, gastroparesis, sleep disorders, come on, chime in.
Pica,
oh boy, yeah. Anemia, asthma, bipolar disorder, mood disorder, impulse control disorder, PTSD, all 6 month PTSD. I'm forgetting stuff.
No, you named a lot of them.
Those are the main ones.
That's a good one.
Okay, we were needing 10 children with special needs means there are a lot of medications, vitamins, and supplements to sort out. While some have medical needs like gastroparesis, many of our children adopted from foster care battle bipolar genetics combined with their PTSD. I believe that mental health needs are just as important as medical needs. And while society chooses to hold a stigma against mental health medication, I will do whatever it takes for my children to be happy. Parenting 10 children. Brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue, I could be violet sky, I could be hurtful, I could be purple, I could be anything you like. I could be brown, I could be blue.
Between this one or that one when I know that I can have both.
Yeah, in a house with 10 kids with special needs, we deal with a lot of behaviors around here. And yeah, we have great therapists, but they're not always available when I need them. So recently, we started using Parenthood. It's so convenient for a busy family like ours. I just go online or to their app and search for an expert in the area that I need help with. It's helpful to get unbiased advice and learn strategies from an expert when I'm in the moment of needing help. At Parenthood, I can often get an appointment within the hour. That's a lot better than waiting a month to get into our doctor. And the first consultation is even free. No matter how big or small your question is, Parenthood can help. And as a mom with 10 kids, there are days I can use all the help I can get. Bree and Patrick Doherty, the 9th and 10th kiddos to join the Doherty dozen. Patrick and Bree lived for years in a residential treatment facility, and they were not having success being adopted together. Caseworkers were about to split this sibling group apart. But once we heard about their case, we fought to keep this brother and sister duo together. It's not always easy, but it's always worth it. Because we believe that every child deserves... with 2nd and 3rd degree burns. He spent 8 days at Golisano having skin graft surgery and healing the infections. As he ages, we continue to go back to the burn specialist to monitor his mobility and range of motion due to the scar tissue buildup. As his body grows, he'll continue to need surgery to help with this. His next surgery is scheduled for July 27th. This is Jason. As a mom to 10 kids with special needs, I have to admit the area that I probably failed in the most was managing and organizing all of their medical information. We have a large list of specialists that we visit on a regular basis, and they all seem to have their own database and way of doing things for their patients. For years I kept thinking, why can't I have all of this consolidated in one place? Well, the universe must have read my mind, because that's exactly what Consolidoc does. This mom gives it a 10 out of 10 for 10. As a mom, we saw Alex's photo listing 10 years ago on the website adoptuskids.org, and we applied with our home study. 7.5 years ago, our caseworker at the time was visiting for our annual home inspection for foster care, and she asked if we would be interested in adopting James. He had been in the system for 4 years and needed an adoptive family. The next week, he moved in. 5 years ago, the twins moved in as foster care placements that we were supposed to have for 5 days. 3 years after that, with their parents' blessing, we adopted them. One day I was at a meeting at our adoption agency, and a caseworker said that she just got a new sibling set on her caseload, and that brought Patrick and Bree into our family. And if you check out our link tree in our bio, we have a lot more articles and news appearances with more details on all of this. We saw Alex